areas of the granuloma. I've used in my patients. I have seen it working, but it can prolong the healing. And the number two way, which really helps the cord to clear very well and to be safe, is just doing the normal cleaning. Then you use either cotton plus spirit, where you clean the area well. Once you clean it and it is dry, you can get your normal table salt. You sprinkle along the base of the cord, and the cord is going to, you're going to leave that salt like 10 minutes, for like 10 seconds. Again, today we are going to discuss about newborns and a condition by the name umbilical granuloma. This is a condition whereby it's a small, soft, pink or red lump that appears above the navel of the babies or above the umbilicus, and especially it happens to almost all the children. And if not well taken care of, it can cause infections. It can cause premature death of the child because of ignorance and or late treatment. So mothers, come closer. If you have a newborn baby around your home, please come closer. We are going to talk to something very important, and we are talking about umbilical granuloma. It's a growth that is above the navel. Once the cord are separated naturally, and you get that there's a small growth which has been left. Sometimes it is moist, sometimes there's some bleeding, sometimes there's some discharge. What you need to understand, it is very common, it's not dangerous, it's not due to the poor parenting, and sometimes it's not painful. What we need is to seek medical attention, because out of getting some clarity what is supposed to be done on the umbilical granuloma, we are going to get the right treatment. I, Pauline, pediatrician by profession, I can give you out of my observation what is going to work for you and what has really changed things. Number one treatment which is recommended, we need to use what we call silver nitrate pencil, whereby we need to clean it well, and we use Vaseline, which we are going to put along the base of the umbilicus, and then we can use that silver nitrate pencil so that we are going to burn the areas of the granuloma. I've used in my patients. I have seen it working, but it can prolong the healing. And the number two way, which really helps the cord to clear very well and to be safe, is just doing the normal cleaning. Then you use either cotton plus spirit, where you clean the area well. Once you clean it and it is dry, you can get your normal table salt. You sprinkle along the base of the cord, and the cord is going to, you're going to leave that salt like 10 minutes, for like 10 seconds. When you leave it for like 10 seconds, we get that the purpose of the salt is going to, the wetness which is around the area, so it is going to make sure it is inafutelo maji from that paste. So if you do it like 2 days, In fact, the third day you get that umbilical stump has fallen out. I want to perform to you practically what is supposed to be done, and there's a video on the same which is going to be shown how you are going to do it. Get in touch, because if you realize your baby is getting umbilicus granuloma, don't blame the mother because of the poor parenting. Sometimes it occurs, and when it occurs, seek the medical attention as early as possible. We need to save our children as early as possible. We need to see that they are doing better, they are growing well, they are smiling, they are breastfeeding well. You as a mother, you are enjoying your motherhood, you are happy, you are loving your child. That's when your child is safe, having good health. Remember, we are like caring, we are nourishing, we are building a nation, a future generation that we are going to be very proud of. Keep in touch here at Pauline TV Show. You are going to get more hints. And if you have any question, any comment about the same, kindly you can WhatsApp, you can go to my email on my bio and just give a comment or your recommendation that we are going to share together. Otherwise, thank you so much. Keep on subscribing, sharing, so that we are going to be at par with each and every one of us. Thank you.